Stroke is one of the leading causes of death and disability worldwide, especially among middle-aged and elderly individuals. What makes it so frightening is that it can occur suddenly, robbing a person of mobility, speech, and even life within just minutes. However, before a stroke actually happens, the body often sends out early warning signals, sometimes appearing just a day or even a few hours beforehand. These signs can be very clear, but at times they may be fleeting and disappear, causing many people to underestimate them and miss the golden opportunity to prevent a tragedy. In this video, we will explore 8 important warning signs you must not ignore, because recognizing them early and taking prompt action could save your life or the life of a loved one. 1. Numbness or weakness on one side of the body. Before a stroke actually occurs, some people may experience a sudden numbness or weakness affecting one side of the body, often limited to the face, arm, or leg on the same side. This happens when the blood supply to a specific area of the brain is temporarily disrupted, usually due to a blood clot or narrowing of a blood vessel. The nerve cells in that region do not receive enough oxygen and nutrients, causing delays or interruptions in the brain's ability to send signals to the muscles. If the affected brain area controls movement in the right arm and leg, the person may have difficulty raising their arm, a weak grip, or an unsteady gait on the right side and vice versa for the left. Sometimes, the sensation is not only weakness but also tingling, like pins and needles, or even a complete loss of feeling in the affected area. A crucial point to note is that these symptoms may last only a few minutes or hours before disappearing, leading many people to mistakenly believe they are just temporarily tired or slept in the wrong position. In reality, this could be a transient ischemic attack, TIA, a warning sign that a full-blown stroke may occur within the next 24 hours. Ignoring this symptom means missing the golden window for intervention and preventing permanent brain damage. 2. Facial drooping or difficulty moving facial muscles. One of the most noticeable and easily recognizable warning signs of a potential stroke is a sudden change in facial muscle control, often seen as facial drooping or sagging on one side of the face. This occurs when the part of the brain responsible for controlling facial muscles experiences a temporary reduction in blood supply, weakening or completely interrupting the nerve signals sent to these muscles. The person may notice it when looking in the mirror, or it may become apparent when they are asked to smile. One side of the mouth will fail to lift as usual, creating a lopsided appearance. In some cases, the eye on the affected side may also droop or become difficult to open fully, making the face appear asymmetrical. This sign often appears alongside numbness or weakness in the arm and leg on the same side of the body, but sometimes it may be the only symptom, lasting only a few minutes before disappearing. Many people mistake it for simple muscle fatigue or common facial nerve palsy, which can delay seeking urgent medical care. However, if the underlying cause is a transient ischemic attack, TIA, it serves as a serious warning that a full-blown stroke could strike within just a few hours. 3. Slurred speech or difficulty speaking. Difficulty articulating words or expressing thoughts is a critical warning sign of an impending stroke, yet it is often overlooked if it appears only briefly. When the part of the brain responsible for language, usually located in the left hemisphere, experiences a temporary reduction in blood flow, its ability to control the mouth, tongue, and vocal cords becomes impaired. This can cause the voice to sound distorted, speech to become slurred, or even result in complete inability to speak. Some people may still manage to speak, but their sentences become fragmented, incoherent, or contain words that do not match their intended meaning. In other cases, they may hear someone speaking to them but fail to understand the meaning, as if all the sounds have suddenly become unfamiliar. Because this symptom often disappears after a few minutes, many people mistakenly assume it is due to fatigue or stress. In reality, sudden language disturbance is a sign that the brain has already been affected, and without prompt treatment, a full-blown stroke could occur, potentially leaving the person with permanent loss of communication ability. 4. Sudden blurred vision or loss of sight. Human vision depends on the coordinated function between the eyes and the brain's visual processing center. When the blood supply to this area is temporarily interrupted, a person may experience blurred vision, partial or complete loss of sight in one or both eyes. Some may see everything as if covered by a hazy fog, while others may only see one side of the visual field, like a picture cut in half. In other cases, people report double vision, distorted objects, or black spots obscuring their view. Because the eyes usually do not hurt and the symptoms disappear quickly, many people ignore them, unaware that this may be the result of temporary brain ischemia affecting the retinal artery or the occipital region of the brain. The danger lies in the fact that vision loss from this cause is often an early warning sign of a major stroke that could occur within the next 24 hours. 5. Loss of balance or dizziness. A sudden feeling of losing balance, unsteady walking, or as if everything around is spinning is a serious warning sign. This is often caused by a temporary lack of blood flow to the cerebellum, the part of the brain that controls motor coordination and balance. When this happens, nerve signals from the brain to the muscles responsible for maintaining posture are interrupted, causing the body to lose smooth coordination. The person may feel dizzy, have unstable steps, need to hold on to nearby objects, or sit down to avoid falling. This symptom is sometimes accompanied by nausea, vomiting, or blurred vision, which can increase the risk of being mistaken for vestibular disorders or low blood pressure. However, if the dizziness comes on suddenly and intensely, along with speech difficulties or weakness in the arms or legs, it is very likely a warning sign of an impending stroke. 6. Sudden severe headache. Not everyone who has a stroke experiences a headache, but when it does occur, the pain is usually sudden, intense, and described by patients as the worst headache of their life. This can result from a blood vessel in the brain becoming blocked or even starting to leak, strongly stimulating the pain receptors in the meninges and surrounding tissues. In more dangerous cases, this is a sign of a hemorrhagic stroke, where a blood vessel ruptures and blood spills into the brain tissue. The headache is often widespread and accompanied by nausea, dizziness, and sensitivity to light and sound. Because headaches can be symptoms of many conditions, many people ignore them or take painkillers on their own. However, if the headache appears suddenly, without an obvious cause, and is different from previous headaches, especially in people with heart disease or high blood pressure, it is crucial to consider the possibility of a stroke and seek emergency medical attention immediately. 7. Confusion or disorientation. Before a stroke occurs, some people may experience confusion, difficulty concentrating, or slow responses to questions. This happens when the part of the brain responsible for cognition and information processing lacks oxygen, leading to impaired short-term memory and language processing. The person may fail to recognize loved ones, forget recent events, or be unable to perform simple tasks like counting numbers or reading words. This feeling usually comes on suddenly and is very different from ordinary forgetfulness. Transient confusion is a very serious warning sign because it indicates that the brain has been significantly affected and the risk of a full-blown stroke in the near future is very high. 8. Unexplained nausea or vomiting. Sudden nausea or vomiting, especially when accompanied by dizziness, headache, or loss of balance, can be a sign that the brain is experiencing a serious problem. When the brainstem, the part that controls vital functions such as heart rate, breathing, and balance regulation, suffers from temporary lack of blood flow, it can trigger the brain's vomiting center, causing severe nausea. Unlike vomiting caused by digestive issues, this condition usually does not come with abdominal pain or diarrhea and may occur alongside other neurological symptoms. This is one of the most commonly overlooked symptoms, as many people assume they are just suffering from heat exhaustion, fatigue, or food poisoning. However, when nausea and vomiting occur together with any other neurological signs, they should be taken as an early warning of a possible stroke. Stroke spares no one, and when it occurs, time is the critical factor that determines the difference between life and death, between recovery and lifelong disability. If you or a loved one experience any of the 8 warning signs mentioned, even briefly, do not hesitate or try to self-diagnose. Call emergency services immediately. Every minute that passes, millions of brain cells may suffer permanent damage. Remember, recognizing the signs and acting quickly can completely change the outcome. Protecting your health today is an investment in your future, and sometimes, just one timely decision can save an entire life.